We back. I didn't want to mess up my video, so I went and stopped it, but it's okay. Yes, retinal detachment is an emergency. But I was talking about how if I did not mention that you would take lifelong eye drops in glaucoma, you will, because you're going to need help with constricting your eyes, your pupils. Understand that when you lose a nerve, it's gone. And y'all, in these patients, the optic nerve has been pressed on. It's been tampered with. So they're going to need help with constricting their eyes. That those eye drops, making sure you put them in right, is helping them. If you don't give them their eye drops, whenever those pupils, that their iris dilate, this can block the flow of aqueous humor. If your pupils are dilated like that, it can block the flow of aqueous humor. Okay. So we're back on retinal detachment. I just wanted to let you know, in glaucoma, you would take eye drops for the rest of your life because you're going to need help constricting your eyes so that a lot of light is not passing through it. That can hurt it. Okay, so we did it with retinal detachment. They're gonna say it feel like a curtain over my eye. So you know that. That's it. We talk about cataracts. Now we're on macular degeneration, and this is the last one for this this lecture. All right, so macular degeneration is an eye disease that blurs your sharp central vision. Your central vision is lost. Proteins accumulate between the retina and choroid of the eye, and that's with dry. In wet, blood vessels are forming on their own in the eye, and they're fragile, tiny, and leaky. And they are leaking fluid inside your eye in macular degeneration. So there's two classes for this disease. It's either dry version or the wet version. We already talked about in dry, protein that look like dirt over time accumulates in your eye under the retina, and it detaches the retina from the eye. So just imagine this being the retina. I mean the retina. Proteins come in between the layer of the retina and pile up and pushes the retina off the eye. Dry is the most common. It's slower because it takes a while for those proteins to accumulate over time. When this happens, your retinal atrophies. It shrivels up. It don't work no more. And this is the degeneration. Why is saying macula? You're talking about retina. Because on your retina, there's an area called the macula that is rich in cones that help you see color. And it's located in the center of the eye, the back of the eye, in the center part. So in macular degeneration, the macula that help you see color in the center of your vision, because on the center part of the eye, it's being destroyed because it's on the retina. It's okay. And the retina is being detached by proteins piling up and pushing it off the eye. The signal to show your central vision is being damaged. It's happening in the center. So you're gonna see hold on. You're gonna be able to see everything around your vision, but you're not gonna see the center. Okay. The macula is on the retina. It has high concentration of cones that help you see color. It's being destroyed in the center of the eye. You can't see color without your macula. They have rods that help you see black and white too, but they're mainly rich in your color cones. Okay. So now let's talk about wet. We already talked about wet. It's where new blood vessels come in your eye and start leaking, okay? This can lead to hemorrhaging in your eye. This leaking of blood in that space leads to the destruction of the macula. So understand where these vessels are being placed. They're being produced out of nowhere in the retina, in the layer of the retina. And this fluid is going, just like how the proteins push the retina off the eye, this blood is going to push the retina off the eye. And the thing is with the wet, this blood, it can leak. It's leaking in your eye. That's making it push up off to detach the retina from the eye. Okay. The name of the proteins in dry that's being built up, I know, it's called drusen proteins. Just know that. In wet, the wet version of macular degeneration is less common, but the onset is fast. Your patient eye gonna be bleeding. Okay. Like I said, there's an abnormal growth of new blood vessels in the eye that are weak and fragile. Look how small your eye is. And if blood vessels are being made on their own in your eye, you know how fragile they can look. That sound. And they leaking in your eye. Okay. The fluid and blood collect under macula, causing scars and visual disturbances. Okay. Signs and symptoms of macular degeneration. They're going to have blurry central vision. They can't see in the center because the macula is in the center of the eye. Macular degeneration. You're not going to see in color your central vision. It's going to be blurry. You're going to have reading issues, driving issues, issues with writing, eating, ADLs. You're going to see blurry faces. So, interventions. Okay, you can also see double whoop-sided vision as well. Whoop-sided vision. So, what that look like, you're supposed to see this tic-tac-toe like this, but you're seeing it like this. So, you're going to need a visual acuity test done to see how well you can see. Modifications. Okay. Increase your light. Also in glaucoma, you need in cataract, they're going to need proper lighting, because in cataract, their vision is blurred too. They're not able to see far away from close up because the lens is messed up. Okay, they're gonna need proper lighting. Interventions for wet macular degeneration. You can have surgery that will blaze those small vessels to prevent them from leaking. And you can have injections that will prevent those new blood vessels from forming. Okay. Large print, y'all, with these eye diseases. You need eye exams, okay. In dry, you're going to take ARDs. You're going to take vitamins, supplements to help preserve your eye. In dry, you have proteins building up in the back of your eye. But if you take vitamins, it will help with that. In wet, you have to have surgery in wet. Bottom line, you can have laser. Yeah. Is there anything else I'm missing? All right, this wraps up the eye. We talked about glaucoma, cataract, retinal detachment, and macular degeneration. I hope y'all enjoyed this. The musical canvas, the RN musical canvases for these lessons are already posted, and when you order my RN Musical Canvas program, you will have access to my RN Musical Canvases. For $30, you have to pay $25 a month to keep your account active. Okay. We will begin with neuro. Woohoo! Got this in the can. I'll see y'all later.